It's 2015 and we've just launched the Sustainable Development Goals, the SDGs, and the updated global strategy on women's, children's and adolescents' health. It's a new agenda for a new era. I'm Gorna, the Executive Director of the Partnership for Maternal, Newborn and Child Health, PMNCH. The partnership brings together over 700 organisations and we achieve much more together than any one agency could alone. The SDGs and the updated global strategy set us on a very exciting course to achieve even more over the next 15 years than we've already achieved in the era of the MDGs. The SDG Summit on Saturday saw all of the UN member states sign up to a new approach to development, sustainable development for all countries. It's a universal agenda and it focuses on countries delivering from themselves in partnership with development partners. And really excitingly, the UN Secretary-General Ban Ki-moon took time on that same day of the SDG Summit to launch the updated global strategy on women's, children's and adolescents' health. It's a front-runner strategy helping the world to implement the ambitious agenda of the SDGs. We're really excited about the prospect of implementing the global strategy. It's a global strategy for the health of every woman, every child, every adolescent, everywhere. And that's where the partnership comes in. It's our role to bring together all of the stakeholders, to align our common efforts so that we can achieve more together. And we can achieve the SDGs and we can deliver on these bold new goals set in the updated global strategy. During the time at the UN General Assembly, the partnership hosted our regular accountability gathering, looking back to see what happened through the era of the MDGs. And the partnership also hosted two really important events looking forward. We worked together with a range of other alliances to think about how do we develop strong accountability measures for the future. One of the big innovations of the SDGs is recognising what we've known for a long time, which is that health doesn't just come from actions in the health sector. It also means improving nutrition, improving education, improving water and sanitation, working on gender empowerment, ending violence against girls and women. These are all part of developing a strong response to improve the health and save the lives of newborns, of women and of children. So what the partnership was doing here in New York is pushing forward on that common agenda. It's been an incredible few days at the UN General Assembly and the world has pledged to get even more ambitious in delivering the SDGs and the updated global strategy, making sure that we can deliver for women, for children and for adolescents in every part of the world. At the launch of the global strategy, the Every Woman, Every Child event, our board chair, Mrs. Grassa-Michel, pledged that the partnership would become the partnership in support of the Every Woman, Every Child movement. I'm really excited that in the middle of October, our board will meet to discuss precisely how the partnership delivers on that mandate. Let's not forget, the SDGs and the global strategy are setting an ambitious agenda for the future. We achieved so much through the MDGs. We halved maternal and child mortality. We saved lives. The SDGs and the global strategy set us the ambitious goal that when we meet again in 2030, we will have ended preventable deaths amongst mothers and children. These are huge and noble goals, and if we pull together, if we work as a partnership, we can make sure that the most vulnerable in society survive, thrive and transform, and we never leave anyone behind.